Hello everybody. We are here with Dr. Farokh Master from India, Bombay, and he's going to speak about the whole COVID-19 situation. And because during this COVID illnesses, there are people, of course, who are just very superficial ill, who are serious or very serious, and there are also several stages of disease. And Dr. Master will speak about these stages and which remedies then are useful in which stage. Am I correct, Farokh?
Yes, yes. Good afternoon, everybody, and thanks to Mr. Rene Otter for recording this video on materia medica and differential diagnosis in different stages of COVID-19. I have been reading about COVID-19 ever since December 2019, when the first cases came in the Wuhan province of China. And subsequently, I am following the newspaper, the internet, the news about how this virus is trying to destroy the humanity. From hospital reports from different countries, I have been able to gather what exactly happens on the first day till what happens exactly on the 15th day of the COVID-19. So I have tried to summarize mostly the data I have summarized from Italy and China, but in the last 3 to 4 weeks, India has become a victim of COVID-19 viruses. Here we saw some little different symptoms, but practically the same. Maybe the virulence of the virus is not so strong as it is in the north part of the Italy, and that is why the death rate in India is not so high. As per today, we have about 1,000 confirmed cases of COVID-19. So in the next few weeks, I'm sure it is going to increase. Unfortunately, homeopathic doctors are not allowed to treat COVID-19 in India. Only medical doctor with a license and who works in the hospital. Fortunately, my hospital, King Edward Memorial Hospital, Parel, has been given permission to admit COVID-19 cases for the last 15 days. And hence, the data that I saw in our hospital, the patients that are suffering, I'm going to put them into what is known as a homeopathic language from repertory, from materia medica, plus I will do differential diagnosis and the keynotes of each remedy at a different stage. This is the whole purpose of this lecture. So friends, if you are ready, let us start with day 1. So I would group day 1 and almost day 3 together. So, and if I have to see the thing between day 1 and day 3 together, the only thing is the flu-like symptom, or what we call as the cough and cold type of symptom. Nothing much comes out on the first 3 days. It's like a typical ordinary influenza type of picture. Takes about approximately 3 to 8 hours to develop that picture. So all the symptoms don't come immediately. And just few days before the whole episode starts, there is a very mild headache. Such a mild headache that you can never understand what is going to happen tomorrow. A very mild feverish feeling, a very distant pain, nothing much, little kathar. You feel like sleeping, you don't feel like getting up from the bed, you don't feel like doing anything. So you go to bed in the night, but next day morning when you get up, it is going to be a very rotten feeling. You will first see that on the bed itself, you don't feel like getting up. There is a feeling of what is known as torpor. At that stage, if you are thinking of some homeopathic remedy from our literature, then gelsemium fits that very well. Now, the identifying features for gelsemium will be a very fine degree of tremulousness, fine tremors, not actual tremors, but a very fine tremulousness when you hold the hand of the patient, or when they try to get up from the bed, you will see a little tremulousness, or when they lift a cup of tea or a cup of milk, you will see little tremors in the head, little shakiness. And then you will see that even though the patient has woken up from the sleep, he looks half sleepy. So he's half sleepy and half awake, you know.
Okay.
And so this is what you will see in a Gelsemium patient after he has woken up. And then after a few more hours after waking up, he starts developing a headache.
Okay.
So, and when there is a headache, it's becoming more worse. There is general aching, general soreness, especially in the muscles. And this is a deep-seated pain. So it's not a very superficial pain that you are going to see in a Gelsemium patient. But this kind of achiness is very important. And then maybe the next day, or maybe in the night, as the night again comes, there can be violent sneezing,
Okay.
there can be a running nose. And do you feel that there is a little blockage at the root of the nose, something like what you see in Kalibai?
Can you repeat a little what?
Block of the nose, blocking of the nose
block.
at the root like Kalibai. You will not see much tonsillitis. That's the characteristic of Gelsemium. You will not see much redness and inflammation in the throat at this stage. Even though the throat may look red, but it may not be so inflamed as in other remedies. But the ears are mostly involved. And so in the ear, you may get a little stabbing pain, you know,
The ears.
and the patient may feel that the ears are a little blocked. So this is, and the patient is quite thirstless. He looks dull, as I said, and half sleepy, tremors. These are the key symptoms of the first 3 days of suffering. If you are thinking of a remedy, as I said, Gelsemium.
So he's thirstless, and can you maybe I missed it because I'm trying to write it down also. How is
Yeah.
the temperature in general of Gelsemium? How
So
does he feel?
I can't hear you. Can you make the volume loud?
How is the temperature? His
Yeah. So temperature is not much. Believe me, it's not much. It may be, he may be having a feverish feeling, but when you put a thermometer, it may not record a temperature for you,
okay.
for sure. And then this, as I said, this happens in the first 3 days. But then there are many other remedies also that you can think of, and it's not always Gelsemium which comes. So, especially, most important thing, another remedy that comes little close to Gelsemium, where patient is little more toxic. Now, what do I mean by the word toxic? The first thing is that the pulse rate becomes higher suddenly. So suddenly, for no reason, the pulse will become higher. The inflammation in the throat becomes much more dark red. That's the second thing. The swallowing may become little difficult. The head may be more heavy. And the person becomes dull. Of course, Gelsemium is also half sleepy.
Yes.
But here in Bacteria, the remedy that I'm talking about, has got extreme dullness, or very close to indifferent, but not actually indifferent, but very close to indifference. And then the bone pain, the body ache is very much strong, especially in the joints. Now see, there is a difference. Gelsemium is muscles, Bacteria is joints. So there is a marked difference between the two.
Okay.
So somebody may show you only the bones, And somebody will say, no, 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 it's not the bones, it's my joints which really is giving me problem. So this is there. And this is how you try to many times differentiate between the remedies, between baptisia, as I said to you, and gelsemium. So that's there.
Okay.
Now, I don't want to show you rubrics of baptisia and gelsemium. You all are very smart guys. So let's go to another remedy which also resembles gelsemium.
Okay.
So basically, we started as a one remedy, gelsemium, which is a main fish, and now we will discuss the little minnows, small fishes, which goes around the gelsemium.
Okay.
So the second fish that goes around the gelsemium is bryonia.
Uh-huh.
Now remember, if gelsemium symptom comes in few hours, bryonia symptom comes after at least 12 to 13 hours. So bryonia state comes little later than the gelsemium state.
Okay.
And in the beginning, I said that gelsemium patients have got a very vague headache and a very little tiredness to begin with. Bryonia patients never start like that. The starting point of bryonia is directly dullness, is directly heaviness, is directly congestion. And the key symptom, now I'm going to discuss the key symptom,
Yes.
puffy face. The face looks puffy, rather swollen. And emotionally, they are quite depressed and despondent.
Uh-huh.
Does not feel like giving you answer to your question. There is no anxiety like arsenic. They are more despondent and they are more depressed. They don't have a fear what is happening to me like arsenic, but they feel that they are really ill and they are very worried about their condition. That is the type of feeling that they get. And they are very difficult to please at that time. So the irritability element comes for the very first time in the remedy bryonia, and then they refuse everything that comes near them. So if you are going to ask, drink water, no. Eat your meals, no. Take your pills, no. Everything is no because they want to refuse. And then they may ask for their suddenly a favorite juice or a favorite drink after saying no. So that kind of psychology is very characteristic, what is known as capriciousness,
Yes.
saying no to everything and then suddenly want, yes, now I want it. So that's the kind of thing. And if at all they ask for something, it is usually plain cold water. This is what bryonia needs, plain cold water. Now, if you keep bryonia patients in a very hot room without a fan, closing the windows, they are very uncomfortable. So this is very important, that they don't want a room which has a closed windows, closed door, no fan. And another very important thing is joints are painful to touch. So you touch a joint and they will say, oh, don't touch, doctor, don't come. Something like arnica, don't come near me. But bryonia will allow you to come near them, but don't touch me. And any heat in any form is the biggest enemy of bryonia. Remember that. Huh? So it's a very hot patient that you are looking at. And then they have a throbbing headache like belladonna. Many people feel only belladonna has a throbbing headache, but it's wrong to believe that if you look at the repertory. So the headache is more congestive, throbbing, and the area which the bryonia patient will usually show is a forehead. So the front portion is very important. Now here there is another difference. In baptisia, the eyes are congested, but in bryonia, you will never see much congestion in the eyes. In gelsemium, you will see congestion in the eyes, but in bryonia, you will not see that kind of congestion. But in bryonia, the eyeballs are sensitive to pressure, so they will not allow you to touch the eyes because eyes has a feeling of soreness. So that's very important. And then after 3 days, 4 days of suffering like this, bryonia patient will develop digestive symptoms or gastric disturbances. Now this becomes much more as the influenza slowly turns into pneumonia. So this is very important. Now, years back, Dr. Borland had mentioned this in bryonia. If you read his book on pneumonias by Dr. Borland, he very nicely gives you a hint.
Yes.
And that hint is that when the bryonia, abdominal symptoms or gastric symptoms becomes much more prominent as the pneumonia draws nearer. So this is very important to understand. And then their appetite is usually zero. So the bryonia patient will not eat for 24 hours, 48 hours. And if at all you force them and if at all they eat few morsels, everything goes into aggravation. So this is another characteristic that if they eat, they go into aggravation. They may develop some gastric symptoms. When this kind of, again, things happen, remember that this is not a simple bryonia influenza, but this influenza is slowly entering what is known as pneumonia. And of course, since they are not eating any food, definitely they will be constipated. It will be hard stool, a very large stool. Most of the aggravations come in bryonia during the daytime. So bryonia is not a very nighttime aggravating remedy, but preferably a daytime aggravating remedy. Now, we have so far discussed Gelsemium, Bacteria, bryonia. Let me take you to another remedy which most of the homeopaths are using these days.
Typical what is going around, what they mention is that so bryonia has the thirst. Is it a lot of thirst or not a lot of thirst?
Now now here I am discussing Materia Medica versus my patient's experience.
Yes.
So far whatever patients I have seen, they want water, but just plain cold water, and I have not been able to tell you with surety whether they require a huge quantity as Materia Medica mentions or small quantities frequently like arsenic. So those are characteristic clinical textbook pictures,
Okay.
which we don't see in practice.
And the second thing they say about bryonia
Yeah.
is that it has stitching pains, severe stitching pains.
Yes.
Did you?
So I didn't see the type of pain, the characteristic. As I said earlier, it is more throbbing and a congestive pain.
Okay.
So I'm just sharing you
Yes.
from my COVID experiences. Even though the picture in the Materia Medica may be slightly different, but I have verified in the repertory and it does exist. So just I'm talking about my observation.
Yes.
So then we go to another remedy, Euphratorium.